What I would like to do today is show you what a typical Graston session looks like. We're going to be doing Graston on Jessica's shoulder here. I've already put the oil on her, so she's already prepared for the session. And what I'm going to do is I'm going to start off with one of my instruments here, and I'm just going to be scanning the area around the shoulder. I am actually trying to feel for adhesions within the soft tissue. And typically what it feels like to me is if there's nothing wrong with the tissue, I feel a very smooth stroke. But if I find some sort of adhesion buildup or scar tissue formation, it'll actually feel kind of gritty to me. And so it'll feel kind of bumpy in a sense. And she will feel it as well. It'll be quite tender to her as I'm going over it. I continue to scan the area, make sure I cover all the muscles surrounding the shoulder joint. So I'll get the posterior deltoid, the middle deltoid. I'll get a little tiny bit of the anterior deltoid, proximal bicep, proximal tricep. And you can see here, particularly in this area, how the skin is actually starting to turn red a little tiny bit. With the Graston technique, we get this reddening effect because we're actually improving the circulation in the area. There's fresh blood that actually comes to the area that brings fresh oxygen and nutrition to the area to promote healing. So what I'll do is I'll just continue to get these certain areas. I'll make sure that I hit the rhomboids over on this area, just medial to the shoulder blade. And right away here, you can see how that's almost immediately starting to turn red. So she has some adhesions built up in this area here. The whole treatment session will last typically anywhere from 2 minutes to 10 minutes or so, depending on what I find during each session. And at the end, we typically end the session with applying some sort of biofreeze, which is a cooling gel, or applying ice to the area for roughly 8 to 10 minutes. We follow that up with some active range of motion. So what I'll have the patient do is actively move the shoulder in different directions, and we'll typically repeat the action 2 or 3 times, and we'll go in different directions. And this actually helps to increase the mobility in the joint as well. And we'll do that for about 2 or 3 minutes. And then that is pretty much the end of the Graston session.